Welcome to today's episode. I'm going to be taking us through process of application, how your application will be, how you get interviews, because a lot of people have been saying, oh, I've sent up to 100 application out to different trusts, but at the end of the day I keep getting unfortunate response. Some people even said they are not getting any response from some of the trust and co like that. I'll take us through some steps on how to do our application, so that at least if we send out 10 application, we will get interview for not less than 7 to 8, which I think is a fair deal. First of all, I won't go through all the application process because I won't tell you how to fill your name. In the last episode, you can check the last episode. We talked about how to some sites where you need to sign up to get to register for a job, to upload your credentials and apply for a job. So we have sites like the Indeed, we have sites like NHS Job, we have the Track Portal where you have to sign up. So after doing that, you write all your profile, your name, your biodata, your academic qualifications. Then there's a part there where you have to fill your experience, like a CPD, like courses you've attended up to date. So I advise always put some courses that also align with what you are currently applying for. For instance, if you are a physiotherapist and you are applying for a musculoskeletal post, you should put some courses like, okay, you've attended recent courses on treatment of low back pain, or treatment of knee pain, management of arthritis. You should put them there. You can check like some of our associations in Nigeria. They organize CPD points. You can see online, you see some courses to attend. Just put them there, up to date. Like you've attended this, up to date. You've attended this in this year, this month. Put so that's what will bring you to the pool. Like, yes, you are still up to date with what is currently going on in the clinical realm. That's one part of it. And one very important part of your application is also your supporting information. There's a part where you have your supporting information. A lot of people have been getting unfortunate response from the application. I think if I should do the math well, is based on their supporting information, how they wrote their supporting information, the content of the supporting information. So without taking much of our time today, I'll highlight some things I've penned down that ought to be in your supporting information to make it acceptable, to make it unique. Because at the end of the day, in a trust where we have like 2 vacancy for a post, trust me, you are not the only one applying from your country. You have a lot of people applying. You have people from different countries. So imagine if you have a position, a space for just 2 people, and up to 100 people apply for the same job. How do you think they want to pick people for interview? Do you think you will be the only one invited for the interview? It's a competitive world. It's a competitive employment. It's a competitive vacancy. So they don't expect only one person to apply. So what they do is program some keywords into the AI. Of course, I'm sure you don't expect one person to read all applications of like 100 people applying from different countries. No, the way they select applicants for interview is that they already program some keywords into the artificial intelligence, the AI software, So this AI software just pick people randomly based on the criteria. If this applicant has some keywords in the application, then call them for interview. So at the end of the day, the AI can just pick 3 people or 5 people for interview out of 100 people or 200 people that apply for the same post. So don't be surprised when you start seeing unfortunately, you're like, how come? I have the experience, I have my qualification, everything is bam. No, it's not like that. You just have to put some kind of, when you are cooking, you have to put some spices there. It's not about you knowing it, it's about them, not you. Now, so you just have to know the difference. Like, okay, this application, it's about the person that wants to pick or the person that wants to interview you, not what you think as an individual that you should be called for an interview. No, the reverse is the case. So now I'll briefly go through some points that should be in your application. So I've picked some like 10 or 12 points that should be in your application. Then I'll explain how you can go about it, how you can write up on it. In your first paragraph, at least you should be able to sell yourself a bit. Then briefly introduce yourself. Just introduce yourself. So brief introduction. After that, maybe next paragraph, you put your academics and qualification. 3, your clinical experience. Do your in the 4th one, you write out the trust value of the trust, their core value. Then in your paragraph 5, you can just put like your leadership skill, because as an independent practitioner that you are, or as a clinician, they want to also examine your leadership skill. Can you lead a team? Can you work with people? Also, you talk about your strength and your weakness. When you talk about your strength and your weakness, then you talk about medical legal aspects. They also want to be sure that you understand the medical legal aspects of your job, not just you doing your assessment, treating patients and let the patient go. They want to also understand that you really know the medical legal aspect or implication of anything you do. So you need to talk about the medical legal aspect. You also need to talk about working with MDT, that's multidisciplinary team. So this place is just, for them to know that yes, you can also work, or you have worked with different team, different professional, both intra and intra. That yes, all of you have worked together to come with a clinical decision to better the care or to improve the care of a particular patient or wherever you have practiced before. You need to also talk about good communication skill. They want to know that yes, you have a good communication skill. So talk about your good communication skill, and also talk about prioritization and delegation. You also want to be sure that yes, you have a good you know when to delegate, when to prioritize. So if I'll go through the points once again, and before I start explaining them. So I mentioned brief introduction about yourself, your academic qualification, your clinical experience, the trust value, leadership skill, your strength and weakness, communication skill. You need to write about your communication skill, prioritization and delegation, medical legal aspects of your work, and in your closing remark also, which will be the last paragraph, you should also be able to sell yourself well in the closing remark. So let's go into brief analysis of these points I've made now. Let's see how we can navigate through it, how we can write 1 or 2 things about it. Yes, because we don't want this video to be too long, I'll just make little comment. But if you need more support in writing your supporting information, you can drop a comment under the comment section, or you can just chat us up, then we'll be able to guide you through how to write it because of our time. So let's pick it one after the other. When you are talking about brief introduction about yourself, in the brief introduction about yourself, you should be able to say, I am a physiotherapist with over a decade or almost a decade year of experience in the field of physiotherapy, managing cases from different units, from orthopedics, neurology, cardiopulmonary, what have you, and I've had the opportunity to work effectively in both private and public sector. That's just a very short introduction about yourself. When you are writing about yourself in the first paragraph, you don't need to be specific and say, oh, I have been working as a physiotherapist or occupational therapist or speech therapist for 3 years or for 4 years. No, just make it more professional, like I've been working for over a decade. So it's just like, oh, you have been working for almost 10 years. So it's not you are putting it like, okay, oh, this person will have the experience. This person might have been working for almost 10 years, like, okay, maybe 9 years, maybe 8 years. So you have a higher chance in that area. So you talk about yourself briefly there. You just sell yourself then. And I said, you talk about second one, I said academic qualification. In your academic qualification, you also need to be brief there and say, okay, as a physiotherapist, I graduated with a first-class degree from one of the best universities in Nigeria, in Ghana, in Zimbabwe, or in any of the countries. I've been practicing as a physiotherapist or occupational therapist or any of the profession. I've worked in a lot of facility, and during my working, I found it as a responsibility to also improve on myself, which means responsibility beacon on me. I have to upgrade my academic knowledge. I proceeded to obtain a master's in whatever you have your master's in, and if you don't have your master's, it's not a must. Master's or PhD is not a criteria to get a job. So you can easily say, oh, as a physiotherapist, I've been working for almost a decade and I graduated from one of the best universities from Nigeria. Name your university where you graduated from. Like, oh, I graduated from Obafemi Awolowo University, Ile-Ife. I graduated from University of Ibadan, Nigeria. You know, so it's just something very brief like that. But I can still give us a lot of things we need to put there. But like I said, I don't want this video to be too long and too boring, you know. So after that, you need to talk about your clinical experience, and where the clinical experience comes in is they want to be sure that you have also gone through almost all the rotations you have in your profession. So for instance, I'll keep making reference to physiotherapy because I'm a physiotherapist. I have practiced in different units. I've worked in neurology, I've worked in orthopedics, I've worked in musculoskeletal, I've worked in community, delivering effective and efficient care to my patients, which and all my planning are patient-centered or individual-centered. I've also worked with private sector. I've worked with the government. So there you are trying to let them know that yes, you've worked in different sector. You've worked with sports. You've worked in the gym. You've worked in the hospital. You've worked with private. So you have idea of how a private run their business. You have idea of how the government run their business. You can easily bring the advantage and disadvantage of two together and sort it out to, you know, to fit in to whatever your trust goals is. So that's that for your clinical experience. You have to talk about where you've worked in different capacity, and also you have to talk about about the trust value. So a lot of people, they miss that point out. When you are applying to a company, you must have read about that company. You must have read about that job you want to apply for. So when you are applying, when you see a job, for instance, on this, I'll try to pull up a screen here. On the screen, you will see maybe you apply for a job in the NHS. When you apply for the job, you will see job description there. When you see the job description, just download the job description, put it on one side. Inside the job description, you will see your clinical responsibility, you will see your general responsibility. Inside that, you will see your working hour and everything. You already know the name of the trust you are applying to. Copy the name of that trust, go and put it on Google and write, for instance, you write XYZ trust core value. It will bring it out for you in Google, and just copy their trust value. Maybe their trust value is kindness, courage, and peace, or kindness, courage, and care. Just put it in that paragraph, and in that you just talk about looking at the trust values, which are kindness, courage, and care. That's the one you saw on Google. I'm sure that the trust value align with my interest. You already put that trust value as a paragraph there, and when you are doing another application, that paragraph is the paragraph you will just keep changing. You don't need to change all your write-up. Just note that paragraph of the trust value where you talk about the trust value. What you just need to do is, in your next job application, when you apply to a DBS trust, copy their own trust value, replace it with the trust value of this ABC trust that you just pen out now. So it's better you first of all write your supporting information in a Word document. You in a Word document first, so you keep editing it, and I'll just show you only two paragraphs that you just need to keep editing in your application. That's the part of the trust value. That paragraph for the trust value, you just edit it, remove the trust value of ABC, and when you are applying to XYZ trust, also carry their trust value and put it in that paragraph. So let's go to the next one. Leadership skill. When you are working in a setting, they also want to know that you have a good leadership skill. They want to be sure that, okay, if at all, if the responsibility becomes on you, will you be able to handle it? How are you going to handle? Because of course, you can't be the most junior and you can't be the most senior. There will always be somebody above you and somebody below you. So there is always a responsibility as a leader in every capacity. Even in your home, there is a leadership quality that you need to exhibit to run your family effectively. So you working in a place with people with different diversity, different culture, different belief, different understanding, different behavior, there will always be one or two glitch. So as a leader, they want to know if you will be able to work it out. How will you be able to lead and make sure this thing does not affect the operation of the trust or the units you have? They want to be sure that, okay, you have this, and part of the leadership skill is for you to be able to resolve conflict resolution. If there is any conflict, how are you going to resolve it? Have you worked in a leadership position before? Well, this is not an interview whereby you need to speak and everything. So you just have to put those key things, because those are the key words they will put in the software that will pick people for interview. So once you've talked about leadership skill, For instance, how have you been able to show your leadership skill in your present place of work or former place of work? How have you been able to resolve issues? So those are the things you will put in those paragraphs, giving them some kind of qualities that you exhibit, which makes you a good leader. That's your ability to be able to listen, and not just to listen, to understand, and not just to understand, to also to implement action after you understand the situation, and implement action at the right time. You get? So you need to put that there. And also, you need to talk about your strength and weakness. And when we are talking about your strength and weakness, you don't want to talk about your strength to make it look as if you are proud, or don't be too, don't make it look, I don't know how to put it, just make it humble. As part of my strength, I have the ability to work under pressure and still deliver effectively. I have the ability to balance both home and work stress together. Those are some, you just sell yourself also in that paragraph. It's talking about your strength. And when you are talking about your weakness, you don't talk about any weakness that affects the job. You also talk about, when you are talking, is like you are talking indirectly. It's also a strength, but you are seeing it as a weakness. For instance, I can say, as part of my weakness, which I'm working on, is my inability to say no, even when I'm overwhelmed with work. A lot of employers, they want somebody they can use, like, yes, that can work anything, to be over efficient or over effective, but when you put it as your weakness, they will not see it as a weakness, but you are seeing it as a weakness. You are pushing it to them indirectly that yes, it's also a strength. It's something that will make them value you. Like, okay, inability to say no when I'm overwhelmed with work, because I know I'm very strong and I can deliver effectively within time frame. So that's you need to put in your strength and your weakness in your application also. And apart from that, you also need to talk about you having a good communication skill. When you are in the health sector, you need to have a good communication skill. A good communication skill actually goes a long way, because when you are in the health sector, you meet a lot of people. People see you as a mini god. They come to you with all their problems. They believe you are the only one that can solve it, especially when they've been to one sector to the other sector, and they now refer them to you eventually, like, okay, go to these people, and this person will be the person to solve your problem. So when they come, they want to meet a friendly atmosphere, a good where even your communication can ease a lot of pain they are having. A lot of people are facing depression. They just need someone to talk to. They just come in, your greetings, your smile, and everything will go a long way. So you must have a good communication skill. So in your write-up, you need to also let them understand that yes, I am a lot of my patients and my colleague, including my manager, has commended me about my communication skill. I have received a lot of praises on my good communication skill, both from patient relatives, and from colleagues, and from a lot of people. So that part, you are already talking about your communication skills. So they believe yes, you can. That shows that yes, you can communicate well with your patient, you can communicate well with your patient relative, you can communicate well with other colleagues, and also with other professionals. So that must not be missing in your application. And you also need to include prioritization and delegation. Yes, as part of what they want to see is that you have a good ability to prioritize and delegate. You have a good sense of when your limits, you know your limits, you know how to send some jobs to your junior colleagues, to your assistants, so that you will be effective at a particular thing, or you'll be able to face a particular work or patient or whatever you are doing. So you have to also include your prioritization and delegation skill. So you have to be able to say, okay, I have a good prioritization and delegation skill. I know when to prioritize my patients. I know when to delegate to junior staffs or assistants so as to provide effective and efficient treatment to patients. So that must not be missing in your application. So another thing we need to look at is your medical legal aspect. Unlike in some countries where they don't take the legal aspect serious, but in developed countries they really take the legal aspect serious. The medical legal aspect, they really take it very, very serious. So you have to also include that in your application, that you are working as a professional, you also understand the medical legal aspects of your treatment, because this is life. You are dealing with life. You are dealing with human beings. These people, they know their rights in the developed countries, and a lot of people can be funny. They just want to claim what is not. So you have to also let them understand that you understand the medical legal aspect, and doing your medical legal aspect is you knowing what you should do at the right time, you knowing how to document effectively, because your documentation is very important. That's what will save you when you are practicing. You need to know how to document effectively and efficiently. Leave no stone unturned when you are doing your documentation. So you have to say it in your application. It must not be missing your medical, that you understand the medical legal aspect of your job, while trying to also provide the best care for your patient. So they know, yes, there. You have to also include safeguarding in your application or in your supporting information, that you understand the safeguarding aspect of your job, so you know when to who and when to raise alarm or to escalate as regards safeguarding issue. You are sensitive to safeguarding issues there. Also be able to mention about your patient information, that you understand how to keep your patient document confidential, that all patients you see, you treat them as a confidential patient, like their record are kept. If your application is lacking all these ingredients, be rest assured there is high chances that your application, you will be receiving unsuccessful email. In your application, don't forget, we downloaded the job description. There should be a part that is talking about, you can have a paragraph saying that yes, I have the ability to. Then in that paragraph, go back to your job responsibility. That's the job information that you downloaded. Look at it. You see your clinical responsibility, you will see your general responsibility. Copy like 4 or 5 things from that your general responsibility. Copy like 4 or 5 from that your clinical responsibility. Copy and paste on that new paragraph where you wrote, I have the ability to. And in that place, they will tell you that applicants must be able to supervise lower band. Applicants must be able to work as an MDT. Applicants must be able to show a good clinical judgment. Applicants must be able to, they will just tell you all those things. So from there, you just copy it and paste in your next paragraph where you say, I have the ability to they said applicants must be able to supervise junior staff. So I have the ability to supervise junior staff, comma, to work with multidisciplinary team, comma, to work as an independent physio or professional, comma, to work as a maybe another thing they say, you must be able to work as a lone worker, so you already put that there. So when these are the things they will input in the AI that will pick people for interview. So at the end of the day, when your application comes in and enters the pool, when the AI is speaking, whatever they've input in the AI, at least out of maybe 20 criteria that they need to pick out from your application, if you are able to meet up to 15 or 16, be rest assured that you will be part of the people they will call for interview. You won't be getting this unsuccessful, unfortunate, and things like that. So you have to put all these ingredients in your supporting information. It's important you put the trust core value. That's showing that yes, you already know about their trust, you know what they stand for. Then you need to put in there what they expect of you, like you've already been practicing it. You have to put it like looking at the trust value. My interests align with the trust value. As part of your supporting information, it's also important for you to indicate some things you are bringing to the table, some things that are special about you. Because a lot of people, yes, you both have the same qualification, you are both registered with HCPC, but what are the special skills you are bringing to the table? If you have the skills, or you're already certified or you are trained in acupuncture, you have to put it that yes, I have a special skill in acupuncture, cupping. I have a special, if you do injection therapy, you need to also put in that yes, you can do injection therapy, you can do manipulative therapy. So those are the things that will actually make you, that will differentiate you from other applicants. These are the things that will scale your application higher than other people. And your clinical experience in your application, you can just make a little case study, maybe for instance, when to show that you work with multidisciplinary team, or you can work in the various settings. You can find an example of where you've worked, or create a scenario where you worked as a lone worker in a rural community and you are able to deliver. Those are the special things you need to put in your application. In your closing remark, you can also sell yourself in this way. Not exactly this way, you can find a word around it. It can go, I will add value to your healthcare institution as I am very committed to working as a musculoskeletal physiotherapist, and I would welcome the opportunity to use my experience and skill to develop compassionate care at your institution and become a better and experienced clinician. I wish to assure you that you can find a diligent and dedicated worker in me. Thank you in advance for your consideration. You can just work around all these criteria I've talked about. Yes, a lot of people can also add more ingredients into this, but trust me, if you have these points in your supporting information, you have a higher chance of getting called for interview. Out of at least you have more than 80% chances. If you write your supporting information, you garnished it well with all these key points, I can bet it with you, out of 10 applications, you are going to see 7 to 8 interviews invites. If you have any question, you need any support, please write in the comments or try to see how to contact us on WhatsApp, on YouTube, on TikTok, on IG. So we'll be able to have some kind of interaction, and we can also put you through. We have a lot of people that have gone through these various stages: nurses, physiotherapists, occupational therapists, radiographer, even the doctors. We have a lot of them, pharmacists. We have a lot of them, healthcare assistants that have gone through this process, and they are already working in the UK, working in the US, working in Canada. So if you need assistance, please comment in the comment section, write your question. We can have a one-on-one session with you to see how we can help you up and see how we can work on your supporting information. See you in next episode. Thank you.